Okay, so we've got our ID notes on parasitic mites, fleas, and flies. We are going to have our name, date, and session in the top right-hand side. The left-hand side is going to be the name of the species that we're talking about. The right-hand side, we're going to actually look at the species that the parasite affects. We're going to look at some symptoms that we might want to watch for in those animals, and then treatment when we do have an animal that has those parasitic infections. So again, we're looking at mites, fleas, and flies. I'm in my ID quiz resources. I have some great information about fleas for dogs and cats, as well as mite infestations. And you guys may have heard of mange before, and that's actually us just talking about mites. So I'm going to go ahead and click on that Quizlet link and bring up our set. So we've already talked about what a parasite is. And a parasite is that organism that lives on or in a host and it causes harm. So we need to make sure that we understand that that parasite causes harm. Then we have our host, and that host is an animal or plant on which or in which another organism lives. So a organism can live on you or it can live in you. We actually have it's on average 1 pound per 100 pounds of body mass humans have of microorganisms. So you are a host to about 1 pound to 2 pounds of microorganisms. Those are not necessarily parasites, but they're things that live on or in you. Next, we have a vector. So when we talk about parasitic infections, there's a whole bunch of different things you can talk about. You can talk about reservoirs and all this stuff, but vector is something that we do want to learn about. And a vector is the carrier of the disease. It's not affected by the disease, but it does transmit to other species. And why we talk about vectors here is because mites, fleas, and ticks, when we get to ticks later, but mites, fleas, and flies tend to be vectors for diseases, or they're carrying diseases. So they're not necessarily affected by them, but they're going to carry them to our other organisms. So that is why it's important to know what a vector is. The first thing we're going to look at as well is our metamorphosis. So these parasites can be identified through their type of metamorphosis, and then we also can tell when they're going to infect an animal based off of that. So the first type of metamorphosis you have is what we call incomplete metamorphosis. Incomplete metamorphosis is when an invertebrate hatches from an egg and then goes through several nymphal stages. Each nymphal stage looks like a small version of the adult, but getting slightly bigger with age. Example with this would be mites and lice. All right, so this is important because I might see a little tiny mite, but it's actually it looks almost exactly like the adult, but it's just going to be smaller. So there is a picture of that. So here is a mite. Here's the egg, the larva, the nymph. Here's a female. And then the male is right there. So not too much difference in there. But the female is that larger size because it's going to carry that egg. So it looks like that right there. Again, you have egg, larva, nymph, female or adult. Okay, that is incomplete metamorphosis. Next, you have complete metamorphosis. So complete metamorphosis is what we think about when we think of our mealworms, right? So the invertebrate goes through 4 distinct stages. They have an egg, a larva, a pupa, and an adult. So fleas, flies, think of your butterflies, think of the mealworms in the classroom. Okay, so that's complete metamorphosis. So here I have my egg, then I have my larva, I have my pupa, and then I have the adult. Right, so at each stage there's something different that can happen at the infestation level. So this is why it's important to understand that you do have 2 different types of life cycles, or metamorphoses rather, because your medication or your treatment is going to differ then whether or not you have adults infestation or egg infestation. We're also going to talk about treatments, and this is why you give treatments within succession. Okay, so 3 months is the bare minimum for treatment for an animal that goes through complete metamorphosis, because you want to hit it at the egg, you want to hit it at the larva, and then you want to hit it at the adult stage. So 3 months is the bare minimum, so that way you can hit at all those different stages. The first animal we're going to look at are fleas, right? Because flea is a type of animal. So flea's the first one. Species that are affected. Mammals, so both mammals and avians or birds can have fleas. Some symptoms we're going to see is iron deficiency because fleas do feed on blood, so they have blood meals. You may see flea allergy dermatitis. Also then secondary infections with viruses or bacteria that are contaminated from the fleas. This could be from the flea tapeworm, from ingesting the flea itself and having that tapeworm egg inside of it, or it can have different viruses and things that when it's biting, then it can transmit. So treatments, you are going to do monthly preventative medication. Once it's infected, then you are going to remove the fleas from the environment by washing all the fabrics and surfaces. You want to do this continually for 6 weeks to 3 months because those those items can have the eggs still on them, and then if the eggs hatch, you want to make sure that you're washing those things. There's products such as a fogger, and those can be used in rooms or on objects. This is where fomites is also important as well. So flea larva, here we have the larva, whoop, teeny tiny, just looks almost like a mealworm. And then you have the adults. So we have the Felis and then Canis. So this is your feline flea and this is your dog flea. All right, so they are primarily species specific, but they can hop to one another. You can get flea bites as well, but they're not going to live on you as they would a dog or a cat. You're not the right environment. Next, we have blowflies. So blowflies are from the family Calliphoridae. And blowflies will affect mammals, avians, and anything that's dead. So any carcasses, doesn't matter what kind of carcass. Symptoms, you're going to see a larva in open wounds or infected sores. So if you have an animal that sliced itself out in the pasture and it doesn't get cleaned, then you may see what we would think of as maggots in that, but that's a larva. Treatment is going to be preventative sprays and then creams or rubs. So really you can prevent these infestations, but it's just about using the preventative medication. So here's an adult blowfly. Whenever flies land, they do vomit up a little liquid mucus. So that's what that little dot is right there. Okay, the next thing we have is our cat warble. Cat warbles are kind of interesting. They are going to affect mammals, not just cats. Symptoms are you're going to see excessive grooming. You're going to also see swollen area around the skin, possibly matted hair near the neck, head or trunk of the animal. So head, the trunk of the animal is what you would think of as the body, the torso. Treatment is going to be removal by a veterinarian. Especially with the cat warble, it's going to be infested when it's a larval form. So what happens is that the fly will lay its egg, and either it's laid its egg on the grass and the cats brush through it, and then the egg attaches. Once the egg hatches, the larva digs into the skin, and then you get this pocket, and then there's just this little hole, and it's the air hole for that larva. So that's why it's imperative that you allow the veterinarian to remove that, because you may not get all of it out, and then you're going to cause further harm to your animal. So the larva is right in there. And then here's the actual adult. So the cat warble is a fly. It's really kind of actually a nifty looking fly if you think about it. So that is going to cause that issue. So again, it's the larva stage that is what is really infecting and causing harm to your animal. Next, we have a horse spot. This is from the genus Gastrophilus. Horse spots are going to affect equines. So here we are going to be a little bit more species specific with that name. Symptoms are very painful eating due to the larva in the mouth. So these are going to, their eggs hatch, and then the larvae are going to be in the mouth. You also have erosion and ulceration in the stomach, or they could be asymptomatic. They may not have any symptoms. Treatment is going to be ivermectin given annually, and you're going to do this at the end of the botfly season. That way you know that those botflies have laid their eggs, and if I treat after the season is done, then I'm going to make sure I eradicate those eggs and larvae from doing any harm to your animal. So here is what the adult looks like. And then this is infected tissue, and those are the larvae. So if I zoom in, you can see the little head and the segments of the body, as you would expect on any invertebrate. Okay, so that's what can happen when they travel inside of the organs. Next, we have Demodectic mites. So Demodex is often what we call these. Demodectic mites are going to affect mammals, so they can travel between species. Symptoms is alopecia or hair loss. You also can have erythema, which is reddening of the skin, and scaling, which is going to be kind of a dryness almost looking to the skin. Treatment is going to be hair trimming, body cleansing with benzoyl peroxide shampoo, other medications, and also preventative treatments can be used. So again, the key with any parasitic infection is to prevent. So if your animal's not on preventative flea and tick medication and heartworm, you're going to want to look into that because many of those will actually take care of mites as well. And then you don't even have to worry about the animal getting sick or infected. So here is the Demodectic mite. So this is the mite. It's got its 8 legs up here. Here's its head, and then its body. Next, we have a Sarcoptic mite. So if you've heard of Sarcoptic mange, that is from the Sarcoptic mite species. Again, mammals. Symptoms is going to be super intense itching. Here we're going to actually have oily dandruff, where the Demodex you had dry skin, but with the Sarcoptic mite you're going to have oily dandruff. Treatment is clipping that fur, again using medication, anti-seborrheic shampoo, and then anti-mite dips may be applied as well. Depends on how severe the infection is. Sarcoptic mite, this mite is really fat, right? So here it's a little chunky monkey, 1, 2 legs over here, and then I think that might count as a leg right there. Not 100% sure just because this image is a little bit fuzzy, but the head is right up in here. Okay, so that is your Sarcoptic mite. So it is fat versus the Demodex, which is straight. So think the S's and the C's and the O's, nice and bubbly and curvy. So that's what the critter looks like. Where Demodex, the D is a straight line. It's hard. So then it's a straight and narrow critter. Then we have Earmites. Earmites are from the genus Autodectes. So auto, ear. Okay, so Autodectes, again, mammals. Symptoms are going to be ear canal inflammation. You're going to see your animal shaking their head, scratching their ears. You might even see a head tilt if it's gone too far. Treatment is going to be based off of the severity of the infection or the infestation. The veterinarian is going to recommend some medication and also ear cleaning. So some of your animals will be more prone to getting Autodectes mites versus others, just depending on that physiology of your animal. So here is your Autodectes mite. Again, still pretty fat, and this is in the ear. So again, here is my head for that mite, and then you have at least 3 legs or 6 that you can see, and then there we've got that. So that is our Autodectes mites. And those are our fleas, our mites, and our flies.